Most people are unaware of this, but pancreatic cancer frequently presents almost no noticeable warning signs until it's too late. And once you pass 60, the risk increases dramatically. What makes it even more perilous? The early symptoms are so easy to overlook or dismiss as harmless. In the next few moments, you'll uncover 8 critical warning signs your body might already be signaling. Do not ignore these. Were you aware that pancreatic cancer claims more lives among seniors each year than colon cancer? Yet most people over 60 have never been informed about its early indicators. And here's what makes this even more alarming. These symptoms appear months before the cancer becomes untreatable. Months. They're happening right now to people sitting in their living rooms, thinking they just need more rest, their back is acting up again, or their stomach has been unsettled lately. As you watch this, there's a 75% chance you've already noticed at least one of these 8 symptoms and dismissed it as something entirely unrelated. I'm Dr. Luis Manochi, and what I'm about to reveal in the next few minutes is something most seniors will never hear from their own doctor. Here's the truth nobody tells you. Pancreatic cancer doesn't have an 11% survival rate because it's untreatable. It has an 11% survival rate because it's caught too late every single time. Stay with me through all 8 of these symptoms, especially symptom number 5. That one has never appeared on any list a doctor has ever given a senior patient, but it should have been at the top. Everything else I share today builds toward that one. Before we dive into the symptoms, you need to understand why this disease is so dangerous, particularly for seniors. Your pancreas can't be felt from the outside. Your doctor can't examine it during a routine checkup. And your annual blood work won't detect this cancer until it's already spread. That's not a flaw in the system. It's exactly why this disease wins so consistently. It hides behind the same symptoms you've been calling aging for years. Here are the 8 signals it leaves behind while it's still beatable. Pay close attention to each one. Box urine. Most seniors who notice dark urine do one thing. They drink more water. The urine lightens for a day, and they assume the problem is solved. That assumption is what costs people their lives with this disease. Here's what's actually happening inside your body. Your pancreas sits directly next to a tube called the bile duct. This tube carries a substance called bilirubin from your liver to your intestines. Bilirubin gives your urine its normal pale yellow color, and your stool its normal brown color. When a tumor grows in the head of the pancreas, it presses against this bile duct, compressing and blocking it. Bilirubin can't flow where it's supposed to go, so it backs up into your bloodstream. Your kidneys then try to flush it out through your urine, turning it dark yellow, brown, or even the color of strong tea or cola. Here's the critical detail that separates this from simple dehydration. It comes back. You drink water, it lightens. But the next day, it's dark again because the blockage is still there. The tumor is still there. Water doesn't fix a tumor. This symptom appears before almost every other visible sign of this disease, and most seniors dismiss it at least 3 or 4 times before mentioning it to anyone. If your urine has been cycling between dark and normal for more than 2 weeks, regardless of how much water you're drinking, that's not a hydration issue. It's a conversation you need to have with your doctor this week, not next month. Upper abdominal pain. Your doctor might have called it arthritis, a pulled muscle, an old injury, or acid reflux. But while you've been treating the wrong thing, this disease has been buying itself more time. Pancreatic cancer pain has a very specific signature. It starts as a dull, persistent ache in the upper part of your abdomen, not your lower belly or sides, but right below your breastbone or slightly to the left. And it doesn't stay there. It wraps around your midsection and settles into your middle back, creating what patients describe as a band, tightening across their torso. This happens because your pancreas is surrounded by one of the densest networks of nerves in your body. When a tumor grows, it presses into those nerves, invading the surrounding tissue. Those nerves send pain signals that radiate outward in every direction. Here are the 3 details that separate this pain from regular back pain. It gets significantly worse after you eat. Not immediately, but within 30 to 60 minutes. It worsens when you lie flat on your back. Many seniors with this symptom find themselves sleeping in a recliner or propped up on pillows without fully understanding why. It doesn't respond like normal pain. Ibuprofen, heating pads, or rest don't help because you're treating the symptom, not the cause. If this pain pattern sounds familiar, stop assuming it's just your back. Tell your doctor the pain is in your upper abdomen, radiates to your back, and worsens after meals and when lying flat. Those details completely change the direction of your diagnosis. Loss of appetite and unintentional weight loss. You sat down to eat, took 3 bites, and pushed the plate away, thinking your appetite just isn't what it used to be. That's not your appetite changing. It's a tumor pressing against your stomach from the outside, physically compressing it. Your doctor has no idea this is happening because you never mentioned it. When a pancreatic tumor grows, it expands beyond the pancreas and pushes against surrounding organs. Your stomach sits directly in front of your pancreas, so when a tumor presses against it, it compresses your stomach, reducing its capacity. At the same time, the tumor disrupts your pancreas's ability to produce digestive enzymes. Without those enzymes, food sits undigested far longer than it should. Your stomach stays full, your brain gets the signal that you're not hungry, and you stop eating. When you stop eating because you feel full after just a few bites, you start losing weight without trying. That weight loss accelerates quickly because your body isn't absorbing nutrients from the little food you do eat. Unintentional weight loss of more than 5% of your body weight over 2 to 3 months is one of the most serious warning signs in all of medicine. If you've lost 10 or 15 pounds without changing your diet, that's not a blessing. It's a red flag. Jaundice and itching. Jaundice occurs when bilirubin backs up so significantly in your bloodstream that it begins depositing in your tissues. Your skin takes on a yellowish tint, and the whites of your eyes turn yellow. In seniors with darker skin tones, it's most visible in the eyes and the palms of the hands. But there's another part of this that almost nobody warns you about. Intense itching all over your body with no rash, no explanation, and no relief from lotion or antihistamines. This happens because bilirubin depositing in your skin irritates the nerve endings directly. Here's the dangerous part. Jaundice in seniors looks identical to jaundice caused by gallstones. Same yellowing, same dark urine, same itching. And because gallstones are extremely common in people over 60, this is where misdiagnosis happens. A doctor sees jaundice, suspects gallstones, orders initial tests, and the deeper investigation gets delayed. Weeks pass, sometimes months. This is why you can't walk into your doctor's office and simply say you look yellow. You need to provide the complete picture. Dark urine, upper belly pain radiating to your back, feeling full after barely eating, and now yellowing of the skin or eyes. That combination tells a completely different story. Unexplained blood clots. Pancreatic cancer releases specific proteins into your bloodstream that alter the way your blood behaves, making it abnormally prone to clotting in places it never should. The most common location is the deep veins of your legs. Your calf or thigh swells, feels warm, and aches with a dull, heavy pressure that doesn't go away when you elevate your leg or rest. Here's where it becomes life-threatening. A piece of that clot can break away at any moment and travel through your bloodstream directly into your lungs, causing sudden shortness of breath, sharp chest pain that worsens when you breathe in, and a heart rate that spikes without warning. If those 3 things happen together, call 911 immediately. Research shows that in a significant number of pancreatic cancer patients, an unexplained blood clot was the very first sign that something was wrong, appearing up to 6 months before the cancer was ever diagnosed. That's how much earlier this disease could have been caught, if someone had connected the clot to the pancreas. Recurring low-grade fevers. You had a fever last Tuesday, it went away. Then it came back Thursday. You assumed it was a bug going around. It wasn't. A bug resolves. This keeps cycling back because your immune system isn't fighting an infection it can defeat. It's fighting a disease that isn't going anywhere. Pancreatic cancer creates constant inflammation inside your body. Your pancreas is inflamed, your bile duct is blocked, and bile is backing up into areas it doesn't belong. Your immune system responds to all of it simultaneously, resulting in a pattern of recurring low-grade fevers that cycle in and out without ever fully resolving. You don't get a high dramatic fever. Instead, you experience episodes where you suddenly feel intensely cold, chilled to the bone, even in a warm room. Shivering comes on without warning, and within hours your temperature climbs to 99 or 100 degrees, not high enough to feel truly sick, but persistent enough to feel consistently wrong. Then it passes, only to return 3 days later. This cycling pattern, combined with night sweats, waking up damp from sweating without being hot when you went to sleep, is one of the combinations that should immediately trigger a deeper investigation. Extreme fatigue. You slept 9 hours last night and woke up exhausted. You assumed you just didn't sleep well. That's not a sleep problem. It's your body being robbed of fuel every single hour by cancer cells, programmed to intercept everything your healthy cells need before they ever get it. Normal tiredness has a cause you can identify: a bad night's sleep, a physically demanding day, stress, and it has a solution. Rest fixes it. Cancer-related fatigue has no solution. You sleep 8 hours and wake up feeling like you didn't sleep at all. You rest all afternoon and stand up feeling just as heavy as when you sat down. Simple tasks: walking to the mailbox, carrying groceries, climbing one flight of stairs, suddenly require effort that feels completely out of proportion to what you're actually doing. Pancreatic cancer cells compete directly with your healthy cells for glucose and nutrients. While your body tries to fuel your organs, muscles, and brain, the cancer intercepts that fuel for its own growth. Your body is running on less than it needs every hour of every day, and no amount of sleep compensates for fuel that's being stolen before it ever reaches where it needs to go. Pale, greasy, floating stool. Your pancreas produces enzymes designed to break down fat in your food. When a tumor blocks the pancreatic duct, those enzymes can't reach your small intestine. The fat you eat passes through your digestive system undigested, and undigested fat changes your stool in very specific ways. It turns pale, almost gray or clay-colored instead of its normal brown. It becomes greasy with an oily sheen you can actually see, floats in the toilet bowl instead of sinking, and produces a smell that's distinctly more foul than anything you'd consider normal. This isn't something you ate. It's a direct mechanical signal from your pancreas telling you a tumor is blocking its ability to function. Alongside this, you'll notice nausea after eating fatty or rich foods, sometimes vomiting, and a general feeling of heaviness and discomfort in your abdomen after every meal. Because your body isn't absorbing fat, it's also not absorbing the vitamins it needs to function. This accelerates weight loss, fatigue, and everything else. Pale, greasy, floating, foul-smelling stool that persists for more than 2 weeks demands a call to your doctor within 24 hours. What you need to do next. If you recognized even 2 of these 8 symptoms while watching this, your next move is the most important health decision you'll make this year. Pancreatic cancer is not a death sentence when caught early. The survival outcomes for stage 1 are completely different from stage 4. Not slightly different, but unrecognizably so. The only variable separating those 2 outcomes is what a person did in the weeks after their body first started sending signals. Most people waited. Most people called it aging. Most people are no longer here to tell you that was a mistake. You're still in that window, but it won't stay open forever. Here's exactly what you need to do right now. Write down every symptom you recognize from this video, the exact symptom, when it started, how often it happens, and whether it's getting worse. Call your doctor and read that list to them out loud. Don't summarize. Don't say you've been feeling off. Read the list exactly. Specific symptoms get specific investigations. Vague complaints get sent home with nothing. If your doctor dismisses your concerns without ordering imaging, push back. Ask specifically whether a CT scan or ultrasound of your abdomen is appropriate. You're not being difficult. You're being the only person in that room fighting for your life. Don't leave this video and go back to calling it aging. You know too much now to do that. If this video gave you information your doctor has never mentioned, hit the like button. It takes 1 second and puts this in front of another senior who needs it just as badly as you did before you pressed play. Subscribe if you are not already here, and share this video tonight with someone whose back has been bothering them or who keeps saying they're fine. You might think you're just sending a video, but you might actually be giving them the window they didn't know they had.